This presentation is for Statistical Process Improvement HAP725. This is a hospital compare case study analysis performed by Sharita Edwards for Dr. Farouk Alimi, PhD at George Mason University. This presentation was prepared as a part of HAP725 taught by Dr. Farouk Alimi, PhD at George Mason University, Department of Health Administration and Policy. Sharita Edwards is a graduate student of Health Informatics graduating in 2021. For this data analysis, data files were downloaded from data.medicare.gov from the years 2006 to 2020. Limitations of the data include missing data. For example, there were some years where there was no recorded data. There were some hospitals that did not have that particular measure recorded for a number of years. Some other limitations include some quality measures were discontinued, and also the measures selected for this analysis pertain only to surgical complications, and only the surgical complications that all of the hospitals shared so that a comparison could take place. For this hospital compare case study analysis, I've chosen Chippenham Medical Center. It is a part of HCA Health System. Chippenham Hospital is a 466-bed acute care hospital. It is a provisional level 1 trauma center. Chippenham Hospital provides a variety of surgical services. For this discussion, I will be focusing on general surgery. I will be looking at indicators that a potential general surgery patient might want to consider before having surgery at Chippenham Hospital. In order to evaluate Chippenham Medical Center's performance in the selected measures, I have chosen area hospitals that are similar to Chippenham Hospital, and they include Henrico Doctors Hospital, which is also a part of the HCA Health System, but it is the Forest Avenue location, Centera Williamsburg, St. Mary's Hospital, that is part of Bon Secours Health System, VCU Health System, and Southside Regional Medical Center. These are the list of competitors. The first indicator used to compare Chippenham Hospital with its competitors was postoperative wound dehiscence, and that occurs when a surgical incision opens up. The rate of occurrence of dehiscence of CJW's competitors, Chippenham Hospital's competitors, was used to calculate the upper control limit and lower control limits. And as you can see, Chippenham Hospital is within control limits for wound dehiscence, and between the years of 2015 to 2017, you can see that the rate of wound dehiscence actually, although it's still within limits, declined quite a bit over time. The next indicator used to compare Chippenham Hospital to its competitors was the complication postoperative DVT and/or postoperative pulmonary embolus. As you can see, Chippenham Hospital consistently stays within control limits through the years 2014 to 2017 compared to its competitors. The next indicator used to compare Chippenham Medical Center to its competitors was accidental laceration. This is the unintended cutting of tissue not involved in the surgical area or not the intended surgical site. As you can see from the rate of occurrence on the y-axis, this is a very rare occurrence. So looking at this chart, initially Chippenham Hospital falls within control limits. In fact, it's very close to the lower control limit, which is almost zero. In 2015, around February 1st, 2015, Chippenham Hospital falls above the control limits, and subsequent quarters after that, Chippenham falls back within control limits, coming closer again to the lower control limit. Next, I compared Chippenham Hospital's postoperative infection rates to that of its competitors. And as you can see in this chart, Chippenham Medical Center consistently fell within control limits. In fact, over the years 2014, they've experienced a downward trend closer to the lower control limit in their postoperative infection rates. Lastly, I looked at a combination of all surgical complications of Chippenham Hospital in comparison to its competitors. And when I created a control limit chart for all of the complications combined, as you can see, Chippenham Hospital started out below the lower control limit, which is great, and consistently was at or slightly above the lower control limit of all surgical complications when compared to area hospitals. In summary, CJW Medical Center or Chippenham Medical Center does pretty well when compared to its competitors. CJW Medical Center falls within control limits for measures that evaluate surgical performance when compared to area hospitals and focusing specifically on general surgery. Chippenham Hospital was above the upper control limit one time in 2015. As I said about that particular complication, it is extremely rare, and the other data points measured during 2014 to 2017, Chippenham fell within control limits, except for that one particular point. When compared to area hospitals, Chippenham Hospital performs consistently near the lower control limit for all general surgical complications. Thank you for listening to my presentation.